Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Hello there, Dr. Grove. How are you doing today?
Hey, Dr. Darrow, I'm living it up. How are you?
I'm living it up, too. It's a great day, and we're here to educate people today how to heal their orthopedic musculoskeletal pain without surgery. I'm going to throw that to you. How do you do that?
We do that with regenerative medicine. We're using the body's healing cells, the platelets, the stem cells, to get some healing going, right? So how this stuff works is we can either do some PRP, platelet-rich plasma. We do a simple blood draw, spin that blood down, concentrate down all those good growth factors floating around in our blood, those good platelets. We can use that to inject, or we can use bone marrow, which is a great source of not only platelets but stem cells as well. We numb up the back of the pelvis for that one, use a small needle, pull out some of that bone marrow, and we can use that to inject, that kind of like a supercharged healing. From there, a little inflammation gets kicked up. That jumpstarts the healing process, and over the course of days, sometimes weeks, sometimes a little longer, we get some healing going in there. If we're putting it into a joint, we know now it can regrow some of that cartilage, decrease some of the inflammation long term. If we put it into a ligament, we can get some strength, some thickening up of those tissues, give you some more stability, which typically leads to less pain for our patients.
That's an amazing process. I've been doing it over 27 years. You've been doing it over a dozen years. And we love the work that we do here because people think it's a miracle because they've been told they need a surgery or they've had a surgery that has failed, meniscal tears in the knee, rotator cuff tears. We got Vicky, her jaw. Let's grab that and then we can pontificate afterwards. Vicky, Dr. Marc Darrow and Dr. Thomas Grove, Living Pain-Free. What can we do for you and your jaw? What's going on? How long has your jaw bothered you for?
It's going on for the last 2 weeks. It's the right side of my face.
Okay.
And I did go to a medical doctor.
Okay.
And they said for me to go see a dentist.
Okay.
And I said, well, what would the dentist do?
Right.
And they said they would hit me up with steroids.
Okay.
And shoot, injections. And you have always said that injections of steroids is very bad for you. It ruins your cartilage in your jaw.
All right.
Or any other part of the body. That's what you have told me.
Well, it's not going to ruin it immediately necessarily, but long-term, yes, and certainly if it's repeated several times. There are cases when we will use cortisone or some other type of a steroid, which are very, very strong anti-inflammatories that get rid of the pain. The problem is it's like putting a Band-Aid on something. It doesn't heal it. And what we like to do, Dr. Grove, you want to talk about TMJ and how you inject them?
Sure. Yeah, so TMJ is no different than any other joint in the body, right? It's, two bones that are coming together, and there's some articular cartilage that allows that joint to glide smoothly. And with TMJ, man, when you've got pain that's kicked up, it's hard to chew. Sometimes it's hard to talk. Sometimes it's really hard to sleep as well. So it can be a really debilitating process for people. But yeah, basically what we do, we put some cells into that joint. It gives you an ultrasound guidance, very small joint, a little harder to hit, just by palpation alone. I love to use ultrasound for that one. To try to get some healing going in there. But yeah, like Doc said, steroids can be useful in the short term for some pain relief, but we know now, hey, long term, probably not a good idea. Definitely not repeated injections for steroids.
Yeah, Vicky, what I call it is winning the battle and losing the war. It's like long term, it's terrible. Short term, you feel good, but it's not worth it to me To be honest with you, I have a story about getting steroids in my shoulder. When I was in pre-med, I had a weightlifting injury, and I was doing a wide bench press, and it stretched out the subscapularis tendon. So I went to an orthopedic surgeon at the university, and he gave me a steroid shot. It felt better in 10 seconds because there's lidocaine mixed in with it. Lidocaine is a local anesthetic that works immediately to get rid of pain. So what did I do? I went back out and did some more weightlifting and other sports, tennis and whatnot at the time, surfing, and it got much, much worse. Okay? So I went back to him. Guess what he did? Another steroid shot. Another steroid shot.
Right, yeah.
And I didn't know anything at that time. I'm going to say it like this. I was a dumb pre-med student. I didn't know about really what was going on for the body and healing. And so it got even worse after that. And, it felt good for a while. Then it got worse. So I went back to him. Guess what he did?
Another steroid shot.
Worse. Surgery.
Oh, no.
And what did
that's
that do?
Worse.
Yeah, what did that do? That jacked up my shoulder for about 4 years. I was miserable until I learned about regenerative medicine. And I went home, and it's such a funny story for people who don't know. My wife was watching TV laying in bed, and I got into bed with her, and I pulled out my syringe, and she's swearing at me like, "What are you doing?" And I said, "Well, I tried this on my wrist, and it worked, so I'm going to try it on my shoulder." And literally, I woke up the next morning 100% pain-free with full range of motion. And at that point, I became a total believer in regenerative medicine. So today we're using more advanced things than back then. That was a long, long time ago. And today we use platelets from the blood. We use stem cells from the bone marrow. There's a lot of different things we can do to help regenerate the tissue. The TMJ, or temporomandibular joint, is very, very easy to fix. And I have cases where people have had surgery, where they're ready for surgery, and we've injected them once, sometimes 2 or 3 times it may take to heal it, and they've had very, very good success. Yours is brand new. I mean, it's only 2 weeks old. You may want to wait a little bit and see if it just goes away. If not, I'm going to give you a phone number to write down now to the office. It's 800-300-9300, and you can call there and get more information. And there's people by the phones now. If they're busy, just leave your phone number. They'll call you right back. And for those of you that want to call us right now and talk to Dr. Thomas Grove and myself, Dr. Marc Darrow, you can call the radio studio, then talk live at 866-870-5752. Vicki, God bless you. There's good healing ahead for you one way or another. If it's my jaw, I'm not going to inject it with the steroids. Stay away from that, okay?
Thank you so much, because
God bless you, yeah.
If that's what they want to do on Monday at the dentist,
I wouldn't do it.
Very nervous about
I just wouldn't do it. First of all, there's probably nothing wrong with your jaw other than it's sprained. Like joints get sprained, ligaments, tendons, attachments get sprained. It came on fairly quickly, and hopefully it's going to go away all by itself. If it doesn't, call my office, 800-300-9300, and you can get a free opinion on the phone and more information from my staff. We're going to go to Christo in Pasadena. He's got an issue with his knee. Christo, what's going on, man?
Hello, how are you, Dr. Darrow and Dr. Grove?
We're living it up, man. How about you?
Hey, Christo, living it up, man.
Well, I'm happy to say that I'm doing the same. And it's been a few months since I came in and had my treatment on my knees. And I'm always mentioning to my better half America that I don't have that pain in my knees going up and down the stairs that had driven me to ask for some help from you guys. I just wanted to say thank you.
Well, that's so sweet that you're calling. And by the way, Christo is my golf instructor, Christo Garcia. And what's the course that you teach at?
I teach at Eaton Canyon Golf Club in Pasadena.
Okay. And you know what? You are probably the most phenomenal golf teacher on the planet. You do something that is kind of unique in a way. You talk about you describe your swing. What is it?
Well, I call it the over-the-top miracle swing. And the reason why I call it that is because if you look at the greatest golfers from the past, say Bobby Jones, Sam Snead, Arnold Palmer. If you look at their hand path in transition, there's a very clear loop over their backswing plane with their hand path. Now, the common teaching today is that the hands in the club head loops the opposite direction under the backswing plane.
And you lose a lot of momentum when you do that, right? Don't you gain a lot of momentum the way you do it?
Absolutely. The way you throw a baseball, a football, serve a tennis ball, throw a right cross, everything is leveraged over the shoulder. And to go the opposite way, like you were bowling or pitching a softball underhand, you just can't create as much leverage. That's why beginners and amateurs all go over the shoulder. It's a natural feeling. But the prevailing teaching today is to do it the opposite way. And I think that teaching has ruined a couple generations of golfers, unfortunately. But
and it's so difficult to do. The modern quote modern swing is really difficult to do. Also, it's very hard to get it, whereas yours is just natural. By the way, why don't you give out your phone number so you can get some people to come out and take a look at this and watch you and maybe get a lesson?
For sure. So my YouTube channel is called Miracle Swing Experience, and you can also find me on Instagram there. My number is 310-699-2857. I'm having a great weekend golf school coming up October 26th and 27th.
Wonderful.
Yeah, so that's always a lot.
Maybe I'll go. By the way, what was the story?
Golf.
What was the story on your knees, and what did you do to heal it? What was used?
Well, I had some torn meniscus in my knees apparently, and I didn't understand what the source of my pain was, and I have really reached the end of my rope. And because you and I were friends and you told me a little bit about what you do, I finally reached that point where I was like, I have to do something about this. And the complaining just, was getting out of hand. And I kind of went into it with a little bit of skepticism, but today, here it is several months later, and I'm just kind of in shock that this therapy was so effective. It was fast and easy.
Well, that's why Dr. Grove and I love it so much. Dr. Grove, what did you see in Christo's knee when you looked under the ultrasound guidance?
Yeah, so a very classic scenario for the patients that come in, right? We've got some knee pain. We got to do a physical exam. We throw the ultrasound on. Yeah, again, some meniscus tears, but nothing too big, enough to maybe cause some symptoms. There's some little ligaments as well that we have little tears in that kind of tack down that meniscus down onto the bone, right? Your thigh bone and your shin bone. At your age, a little touch of arthritis, nothing too bad. But the key is, get into this thing, right? Get some healing going in there. Get a little bit of offloading, right? It wasn't a super long period of time you had to be, off of the golf course, but something's definitely necessary. Give yourself a good amount of rest. And then from there, it's just a matter of time and how many treatments that you need, right? And then once you start to feel better, it's not like we're covering it up with, a steroid shot. You're getting some healing going, right? You can go back up and start using that tissue again, get back out on the golf course. So it's a really awesome tool. And again, we love our golfers, a lot of, overuse injuries. Crystal, I'm sure you see a lot of that with, poor form that leads to things wearing out a little sooner. But man, regenerative medicine can be an awesome tool for people like yourself.
Anyway, Crystal, God bless you, man. I'm so happy you had a great healing, and I look forward to getting another lesson someday. I watch you actually on Instagram every day just to get that locked into my head, how to do that swing. And honestly, I found it to be a miracle. And I remember when I went out with you, and it was in one swing, I was hitting the ball so much farther and so much more crisply, and I couldn't believe it was so easy. So I think you're a miracle worker, and I love that you call it the over-the-top miracle swing. It's a great name for it. And it really isn't over the top. It is in a sense, but when I look on a video of what my swing is, your swing, it's right on plane when you're through transition, through impact and all that, which is what everyone wants.
The phrase over the top has a bad connotation in golf because when people use that phrase, they're very often referring to swinging from out to in, which
but
causes
this
a big splice on the ball.
Right. This actually, your swing creates a great draw instead of a fade. I guess you could do either.
I'm still hitting the ball from the inside.
Yeah.
I allow my hands to loop over
Right.
inside and over the top.
Yeah.
So it's not, outside and then over the top. Which
Well, I hope
causes a
you
huge
golfers
slide.
listening picked up something today from Cristo Garcia. Cristo, give out your phone number again so people can get a hold of you. I'd love to have the whole world playing golf with your swing. What's your phone number?
My number is 310-699-2857, and it's just the easiest way to leverage the club and hit solid golf shots.
All right, man. God bless you. Anybody who wants to look up Miracle Golf Swing on Instagram, and you'll see the swing in action. You'll see Cristo's got probably the prettiest swing on the planet. So he's like, I think you were didn't you learn ballet? So his golf swing is very much like that. It's very, very smooth and beautiful. All right, we're going to move on. Dr. Grove, we're going to give out the phone number to the studio right now so people can talk to us live. So if you want to talk to us right now and ask your questions about yourself or your friends, your musculoskeletal pain, things that maybe you've had a surgery on that didn't work out, the phone number to the studio is 866-870-5752. That's 866-870-5752. And you can go to the website. There's a spot there where you can email Dr. Grove and I. We answer our emails every day. And the website is www.jointrehab.com. That's www.jointrehab.com. If you want to talk to the staff and get a free consult with them over the phone, call right now at 800-300-9300. The office again, 800-300-9300. So Dr. Grove, I'm going to try to stump the star. That was a TV show or something, I think. But we like to get, right? We like to get questions that are difficult to answer. And we do get emails all day, all night long. And I'm going to hit you up with one of them right now. Oh, this is a cool one. Elos Danlos. Tell us what that is.
EDS.
EDF. And
it was on my list of things to discuss today. We've been getting a lot of email inquiries lately about this.
We have,
so
I know.
Basically, we've got a lot of, connective tissue, collagen all around our body, right? And so when you're looking at things like ligaments, things that attach bones to bones, right, tendons, within the joints, we've got good collagen. Now, we've got different genetic disorders. EDS, or Ehlers-Danlos syndrome, is one of those, where basically that tissue gets a little stretchier, right? You think about like the circus contortionist, it's like an extreme example. But certainly, I've spent over a decade being with high-level athletes. We see it a lot in our, taller athletes, our basketball players, some of our volleyball players. But some of the best athletes in the world, they're a little bit stretchier than average, which gives them an athletic advantage, right? Especially things like if you're a throwing athlete, you have more of a recoil sort of effect, right? But what can happen with that is you get what we call laxity, ligamentous laxity, meaning that ligament gets a little extra stretchy, which can cause chronic pain, right? If it's really bad, sometimes it causes a subluxation, which is a partial dislocation, or a full-on dislocation. And so this is a really, really interesting area where there's not a whole lot of treatment available. I don't know what you've seen over your years, Doc, but I haven't really found anything other than regenerative medicine to actually, go in, get some healing going, thicken up these ligaments, give them some more stability. And once you have a little more stability, those types of patients do benefit from a good, resistance training program to help keep the muscles strong around those areas. But that can be really, debilitating condition for people, especially over, your large joints like your shoulders. We see a lot of SI joint issues or lumbar ligament joint issues. And again, people just covered up with pain medications, and they don't really get anywhere because you're not really getting to the core source of what's going on, which is, it's really like a collagen issue. It's a connective tissue issue. So it's a really awesome tool using regenerative medicine for this.
In my experience, I've had amazing results using platelets and stem cells. I had the craziest story. There was a gymnast, a girl who was in her early 20s, and she stretched out her shoulder, and she not dislocated necessarily, but subluxated. Dislocation is a total movement of a joint where the bone comes out. You can have a shoulder dislocation, hip dislocation, a knee dislocation. Any joint in the body really can do that. And it would go out, and then she'd push it back in. So it was subluxing about 8 times every day. She was miserable. And we took about 2 or 3 stem cell treatments on her shoulder, and that shoulder tightened up. It no longer happened. And that's typically what I find. You've got to do a lot of injections around those areas to tighten up and grow and thicken up all the ligaments and tendons so that joint is no longer lax, loose. And this is actually
exactly. I mean, even if someone didn't have EDS, I mean, anytime I hear a joint dislocation or a subluxation, man, if it's my body, I'm getting some cells in there and trying to tighten that up. Like you said, the more that we get those sort of partial dislocations or full dislocations, the more likely we're going to get even more of them, right? So it's a really important factor to consider in terms of longevity. Is okay, well, how do we get this thing more stable so you can use that body part the rest of your life?
I'm going to give out the phone number right now so you can talk to us live, and then I'm going to get to the actual questions about Ehlers-Danlos. So if you want to talk to Dr. Grove or I, Dr. Marc Darrow, the phone number live right now is 866-870-5752. That's 866-870-5752. And if you want to call the office and get a free phone consult with our staff, the phone number to the office is 800-300-9300, 800-300-9300. If you'd like to email Dr. Grove or I, you can go to the website, which is www.jointrehab.com. That's jointrehab.com. And here's the actual question that came in about Ehlers-Danlos. I'm going to spell it for everybody because it's a weird-sounding thing. It's EHLERS-DANLOS. Those are 2 doctors. Usually when you see a syndrome, it's doctors' names who, diagnosed it or figured out what it is. So this person says, I believe I have Ehlers-Danlos. I'm in constant pain everywhere. I work physical labor, which may be contributing to physical stress. I mainly have the most pain in my neck and my shoulders. Then it's the back, sometimes my arms, wrists, and fingers. I've tried acupuncture and chiropractors, and none of that has helped me. I'm not exactly sure what treatment would best fit my needs. Perhaps I need a consultation appointment for first patient. I don't know what that means. I'm available Fridays. Please let me know your next Friday availability for appointment. Also, please email me as I'm at work, and we can try to get in at 3:30 p.m. Okay, that's cool. So just because someone has pain all over, Dr. Grove, does that mean it's Ehlers-Danlos?
No, not at all. Yeah, again, the pain could be coming from a number of areas. I mean, at the end of the day, we want to identify what the source of somebody's pain is and, go after it. But typically with true EDS, you might have multiple areas that are troublesome for you. But, getting back to the basics, we said every week, hands-on physical exam, let's stress those tissues out and see if you truly have laxity, right? Regardless, just to say that you do, what's the best option that we have? I haven't seen anything better than regenerative medicine to go in and try to tighten up, give some stability to these areas that are causing trouble for someone.
So you mentioned tighten up. Do you actually know the pathophysiology of how the body that has pain in a certain area can actually grow tissue back? Is it real? People say it's not real.
Yeah. So, it's so, it's frustrating. It's just, you're not quite up on the current literature, but we have the studies now where they're taking tissue before and after these injections under a microscope, right? We can actually see that, tendons thicken up, ligaments thicken up, the quality of the tissue gets better. So especially for someone with EDS, it's the stuff that's being laid down, that collagen, that isn't quite as strong as someone who maybe doesn't have that condition. And we can actually see, after we have treatment, that we get a better quality on a patho slide, right? You take that tissue, slice it real thin, look at it under a microscope. It's a better, quality of tissue. So, yeah, to me, when people say that, they're just not up to date on the current research and what's happening with musculoskeletal medicine.
And as far as, this diagnosis of Ehlers-Danlos, that's just one way of looking at things. But this stuff that we do, using platelets and stem cells, grows tissue wherever we inject it. And, in my first book, which is prolotherapy, living pain-free, which I did years and years ago, which was the old style of regenerative medicine, just using concentrated dextrose to irritate the issue and stimulate fibroblasts to come to the area. Hang with us, everybody, and we'll finish up this scientific talk on how to heal your musculoskeletal pain. Give us a call at the studio live. You can use a fake name. Don't be shy. 866-870-5752. 866-870-5752. We want to hear from you. God bless you all.
You're listening to Living Pain Free with Dr. Marc Darrow and Dr. Grove. Their practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment. Stay tuned.